Hi everyone, my name is Sribhavya Koneti, and today I'll be presenting on integrative medicine and how it can play a role in treating the world's leading cause of death, cardiovascular diseases. To introduce myself, my name is Bhavya and I'm a rising junior in Reedy High School in Frisco, Texas. I have a strong passion for cardiology, medicine, and community service. I volunteer at the Baylor Scott and White McKinney Hospital, and I'm also the science coach for a nonprofit organization called North-South Foundation. At school, I am involved in the Global Health Equity Club and Women's Health Club, where I help design and lead the projects there. My passion for integrative medicine actually stemmed from my own household. So whenever I fell sick, my family would give me a soup made with tamarind and several other herbs before turning to medications. Of course, they would later on. This approach would actually work, which made me wonder if it could manage more serious illnesses. So, coming to the problem. According to the WHO, an estimated 17.9 million people die from cardiovascular diseases each year, making CVDs the world's leading cause of death. Apart from this, the World Heart Federation predicts more than 23 million CVD-related deaths per year by 2030 and costs rising up to $749 billion by 2035. So, given these alarming statistics, the question is if the current mainstream healthcare system is ready to effectively combat this global health issue. Before we answer that question, it's important to note that cardiovascular diseases are often chronic and lifelong diseases, which means that the primary treatment plan should focus on preventative methods and holistic healthcare, which can promote overall well-being and in turn support cardiovascular health. Unfortunately, though, the current healthcare system doesn't fully emphasize these key areas completely. So what can be the solution? As a potential solution, we may need to incorporate ideas from ancient medicine into modern medicine. So let me explain. Modern healthcare focuses on treatment through drugs and surgeries, whereas ancient system focuses on prevention and management. Therefore, by integrating these two systems together, we can create integrative healthcare to address early detection, prevention, and all in all, a reduction of the CVD cases. Integrative medicine can be broadly classified into two categories. Nutritional therapy, which includes herbal medications and personalized diet plans, and mind and body therapies encompassing practices such as acupuncture, yoga, tai chi, and others. Keep in mind that these therapies have to go alongside conventional medications to be called integrative medicine. If we implement this integrative approach in our current healthcare system, besides the scientific benefits, there are also economic advantages. First, let's look into the solution through a scientific perspective. The National Program for Prevention and Control for Cardiovascular Diseases and Stroke analyzed the effects of integrative healthcare on 1,938 patients with essential hypertension. So they administered yoga, lifestyle modifications, diet changes, and in some cases even gave them Ayurveda medications alongside conventional medicine for hypertension to see how it affects their blood pressure levels. And as you can see on the slide, after 6 months, the blood pressure, both systolic and diastolic, experienced a significant reduction from 150/90 to the normal ranges of 120/80. Not only was there an improvement in hypertension, but also its symptoms. As you can see, these symptoms are non-specific. Headache, sleeplessness need not be caused by cardiovascular diseases, but also could indicate a plethora of other diseases. This shows how this integrative approach not only targeted hypertension, but also promoted overall well-being and prevention of other potential diseases. Like I mentioned before, there's also an economic advantage. Traditional medicine emphasizes self-healing and preventative methods, relying on natural sources rather than cutting-edge advanced technology. This makes it a cost-effective option, particularly in rural areas. In developing countries like India and parts of South Africa, traditional medicine is often the sole healthcare option due to its affordability. Moreover, many rural residents also have concerns about the potential side effects that they will experience if they go to a hospital, which makes them prefer traditional medicine over hospital care. By relying on integrative healthcare, these individuals can potentially reduce long-term in-hospital costs because they're already on a preventing diseases plan. Despite the astonishing scientific and economic benefits, there are some important limitations that we need to consider. Some of the herbs chosen for the medication can have adverse effects on the body. A study performed by Jennifer Joan Ryan and a group of researchers stated that 2 of the 19 participants experienced adverse effects, especially in the renal arterioles, after the integrative herbal treatment. So, what could be a potential implementation plan that takes into account both the benefits and the limitations of this integrative approach? The main element of integrative medicine is to adopt herbal medicine into national drug policy. Governments should integrate herbal medications with conventional drugs to treat cardiovascular conditions like hypertension and heart failure. Regulatory entities must be established to ensure the safety and efficacy of these drugs before they're released out into the public. Furthermore, clear standards should be set to ensure the credibility of these practitioners who are in this system. This approach has already been implemented in China, Japan, rural India, and other countries in South Asia. As society advances, more and more diseases related to lifestyle are becoming prevalent, and modern medicine is becoming increasingly expensive. Therefore, it is crucial to understand that holistic and preventative medicine, both ideas of integrative healthcare, should be the new future of medicine, also known as meta-medicine. Thank you all for listening to my presentation, and here are my references. And if you have any questions, please don't hesitate to reach out to me. And finally, I would like to thank GHLC for giving me this amazing opportunity to present today. Thank you.